Doctor, welcome to my show. Thank you so much to come here and give us a brief explanation about post-COVID care in such a short time. Thank you so much, and as usual, you look lovely.
Oh,
and just for our viewers, Dr. Aneesh has been my dermatologist for the last 5 years. A lot of people keep texting me on Instagram and even mailing me through YouTube, asking me to give us some skincare tips and how you maintain your skin at your age and blah blah blah. So we probably in the end.
What beautiful, Sangeeta.
Thank you. I'll take it as a compliment. Anyway, so we will talk about skincare and hair care towards the end of the show.
Yeah.
But today is a very interesting topic that we are going to be discussing about post-COVID care. What are the symptoms that we all faced, and post-COVID, what all care to be taken, right, from food to skin to hair. So, and you have been in the war room for, I think, 6 months you were there, because I was seeing your updates and posts. And though being a dermatologist, you were so active during this pandemic. I'm very proud to know you, and you've done a great job.
Thank you so much.
So we all have, the whole world has gone upside down because of this pandemic. And one very interesting thing, we are the first generation to see this pandemic.
Correct.
The last pandemic the world saw was, I think it was in 1980, H1N1 virus.
Yeah, the influenza virus.
Yeah, the influenza virus, the whole world saw, and I'm very sure none of them who have experienced the pandemic is alive today, because I think it's almost 100 years now.
Correct.
And
we have stories
to tell to our children and grandchildren. Hopefully, this should be the last pandemic in the world. Hopefully, let's pray, let's hope and pray. Fingers crossed that we cannot go through and a lot of people have gone through, mentally, including me, I've gone through such mental trauma. Trauma in the sense, even being at home, I also was affected by COVID. But then luckily, because of my fitness, it didn't, bring me down completely. So I just, talking about my COVID experience, so I know all kinds of body pains. I've given birth to 2 children, so I know that kind of body pain. I work out for 2 hours every day. I know that body pain. I do a lot of,
You're really revealing your secrets, Sangeeta.
I'm not revealing.
No one thinks you're that good.
I have revealed enough of my secrets in my show. So, I do various body pains that I go through. Every woman goes through different body pains. I do a lot of physical activity. So, one particular day, I still remember, I think it was in the second lockdown, I think. I just woke up with the worst body pain ever. And I knew this was not any regular body pain. But then I was absolutely fine. I just had body pain. I worked out that day, I still remember. I just still remember, because I'm like a kind of psychotic woman. When it comes to workout, I have to finish my workout. I finished my workout, came now. I still had body pain, but then I did want to come to terms, it could be COVID.
Right.
It could be COVID. And obviously I live with my family, husband is there, kids are there. So I was a little worried, but I was only worried that, they will hospitalize me. So what I did was, I had a good nice, I had some carbs, I had some biryani or something, I went to sleep. I still had the body pain. Then evening I took a dolo, I went to sleep. Next day I was fine.
But in the meanwhile, you isolate yourself, right? You didn't want to come in contact with your family.
Yeah, I didn't come in contact with my family, but then I was to myself. Anyway, everybody, lockdown was there, everybody was watching Netflix, TV, everything. Right. So each one is glued to their TV doing what else to do after work or post work. But no maids finished cooking, maid slept. And morning I was absolutely fine.
Right.
What happened post-workout? I had my protein shake. I couldn't taste my protein shake.
Right.
That was the first symptom. Right. I said, oh my God.
Okay. Then you came to terms with it.
Even then I didn't come to terms with it. So I wear very strong perfume. I thought, let me, smell my perfume. I tried to smell my perfume. I couldn't. So that was the only symptom. I lost my taste buds. I couldn't smell. It lasted for 2 months. Other than that, I had no other issues. No breathing problem, no body pain, fever. I had it for 2 or 3 days. I was absolutely fine. But the taste buds and the inhaling came only after 2 months.
That's purely because of your exercise schedule and your diet, which you keep following.
Yes.
Because you kept yourself healthy
lifestyle. Healthy lifestyle.
So now
I have a lot of soldiers inside me.
Yes.
All my, antibodies.
Correct.
They fought it pretty well and they chased him off.
So what people usually are doing now is they wait until something happens, and that's when they start realizing health is very important. Okay, but then you are an early bloomer. Probably you understood that much earlier, and you were taking care of your health, and that's the reason why you fought it so easily.
I guess so. So what happens is, like, I come across a lot of people who have suffered COVID and a lot of fatigue. They complain of it. Most of them come to me, ask me for counseling. I have a lot of fatigue, headaches. They still haven't recovered completely. So for me, it was just for 1 or 2 days and it's gone. I don't even know, and I don't think even I didn't even tell my family that I lost my princess because I was so scared that they were going to hospitalize me. Because I had a lot of friends who were in the hospital and were suffering and all this stuff. So I thought, why should I even tell them? I know it's not ethical, but then but my family people were fine. I mean, nobody had other than me, nobody had it. But I survived beautifully. So I just wanted to know. Post-COVID, a lot of people are complaining of fatigue, tiredness. They have not recovered completely. They are not themselves like what they used to be. I think for me, I have become even more stronger. For me,
both mentally and
physically. Mentally and physically, I think I have become even more stronger. But anyway, jokes apart. So I just want to know, what do we do? What are the care to be taken post-COVID? What kind of, as you're a skin doctor, and I can see you have glowing skin, just like me. So, what is the food intake that we take? I always keep putting a lot of food videos and health videos. I keep seeing them. But if it's coming from the horse's mouth, it is actually basically we all know what to eat. Don't we know what to eat? What is junk food? What is healthy food? But for we humans, if a doctor is saying, it registers. See, I'm not a doctor, I'm a nutritionist. But
no one better than you to talk about diet and exercise.
Yes, for me, but
I love it. I love the way you do it.
But I love, you have given me a lot of tips when it comes to skin, how to maintain your skin post-40 and so many basic tips. And along with skin tips, give us tips that will help us recover faster. And for senior citizens, like, there are so many elders living with us, like elders living with us, how to take care of them, what kind of nutritious food to give them, what kind of different vegetables, like name certain vegetables and food that you can build your immune system.
Right. I get that.
So tell me about your experience, a short brief about your experience during the pandemic, how it was.
First of all, I think it's a very apt topic which you've chosen to discuss, because most of us, have seen people being affected by COVID, and we were only talking about COVID and how people are during that period. Now we are seeing lots of people who come out and they talk about being fatigued, being, having body pains, having mental clouding, they can't think, they can't focus,
and migraines,
they have, shortness of breath, and that. Once starting the history, they talk about having COVID probably around 4 to 8 weeks ago.
Okay.
So this is a post-COVID syndrome which you are facing. See, this is the first thing which, first of all, we don't know the virus very well, right? So we don't know what the after effects are. We don't know what the after effects are. So these are the new things which are coming across now. Okay. So once you get a negative report, it doesn't mean that you are completely free of COVID and jump back to normal routine. You have to give yourself, some time, your body some time to recoup, to become normal, to get stabilized, because there's lots of inflammation which is happening. The virus which is entering your body is not only affecting your lungs, it's affecting your kidneys, your heart, and all these areas. Okay, so
each and every organ
is being affected. So you need to give yourself the time, your body that time, to again regenerate and become normal.
How long does it take to recover? Is there a set time? 2 months, 3 months?
It is completely personal.
Depends on your fitness level. That's why I keep telling my viewers how important exercise is.
So that basically, we've heard of people who didn't step out of the house, who were only inside, no human contact, and they get COVID.
They were affected.
Okay. But people, some of my colleagues and me, we were like, in the mid of everything.
You never.
Yeah, exactly. And and then we did not. So it's just your lifestyle which was there prior. Okay, it's a mental makeup also. Okay, if you keep thinking negativity, you're really scared of it, and all of that, you're inviting it. You're already you're lowering your immune process.
Yes.
Okay, so if you're more confident,
I believe even junk. I don't believe, but it's a fact that even eating a lot of junk food
definitely
it reduces your immune system.
Yes.
So one plus point about me is I never eat outside food. Even when I go out,
Oh.
I never eat outside food. I eat at home. I have my lunch, whether I'm going out for lunch.
Another secret out.
Yeah, I never eat at home.
Yeah.
Okay.
Okay.
Maybe I eat. Worst come worst case, if I'm traveling, I'll have a curd rice or grilled chicken. That's it. I will. If there is no food also, if you leave me alone in a desert for 3 or 4 days, I will just not touch outside food. I will come no matter how late it is. I will come home. I will make my own grilled chicken. Or worst come worst basis, I'll have a peanut butter and bread or my almond milk and bread. That plays a major role.
Exactly.
The whole junk foods,
the old wisdom which we stopped following.
Yes.
Your rice other which you're talking about, the curd rice.
Yeah.
Okay? It is like, who eats curd rice?
And everything is so quick. I mean, everybody wants Swiggy, Zomato. I don't even have Swiggy, Zomato on my phone.
Oh.
I really don't have Swiggy.
I'm installed today.
I don't because, first of all, I never get tempted. Even if my kids want to order something, I will tell, give me some time. I will go make it. I will somehow Google, YouTube the video and I'll make it for them. It's a genuine thing. Okay. So and basically I love cooking. And so I try to bring that lifestyle into my children from a very young age. Okay. Whatever you want, try and avoid outside food as much as possible.
Great.
It plays a major role.
It does.
I know food is your immune system.
Yes.
And junk food depresses you.
Correct.
As it is, we are all going through depression. Or do we say, okay, we take our app, order and then we eat and sit and watch Netflix. That's not everybody. There are two things that has happened to people during this pandemic. Either they have lost weight, they have reinvented themselves completely, like someone like me, or somebody who's totally got into depression and put on weight. But nevertheless, that's why you are here today to give us tips. So what kind of food to take post-COVID? And what age group? I mean, even children and elders.
See, all of us, it's a standard norm that we have to have lots of fresh greens and vegetables.
Plant-based food.
Yes, plant-based food as much as possible. Okay, because they are the ones who are bubbling with energy, with enzymes. Okay, that's what we require. Okay, with micronutrients. Okay, not the macronutrients.
5 to 6 plant-based foods.
Okay.
Just for the viewers.
Okay, so basically we are looking at more of broccoli, more of tomato.
Broccoli, I believe, has got a lot of glutathione.
Glutathione, yes.
Glutathione.
Yes.
It's an antioxidant. Antioxidant. I have broccoli soup every day in the broccoli soup with a little broccoli soup. Okay, next.
So lots of green leafy vegetables, on the palak.
I had posted that moringa leaves.
Moringa, yes.
In Tamil it's called 𝒟𝒏 and
moringa.
Moringa leaves. Very, very healthy. Even the stem is healthy. We make soup out of the stem. Leaves, we make the 𝒟𝑒, the palak 𝒟𝑒 that I had posted.
Great.
Yeah. So there's a lot of greens.
Yes, lots of greens. Lots of food rich in vitamin A, so that's all your yellow and red colored foods. That's carrot, beetroot, papayas, all of these as much as possible.
And lot of protein.
Lots of protein. Yes, of course. So that's a macronutrient. So good protein, would be something like a non-veg base. Okay. So chicken breast. But then because proteins are your building blocks. Okay. So that is very important that you start taking lots of protein, especially after your
doctor, let me cut you short. I had recently posted how to make your protein shakes.
Correct.
According to you, is taking protein shakes healthy?
Taking protein shakes is healthy, as long as you're taking the right quantity and the right form of it.
Okay. So I'm talking about the powder that I recently posted a video taking whey protein along with.
That's what I'm saying. As long as the quality is good.
Quality is good. Yeah.
So it's from a recognized company.
Okay. It's healthy. Because there's a lot of myths. We're not supposed to have a protein powder. It's not healthy. What I feel is protein powder is healthy provided you do a lot of physical activity.
Exactly.
Physical activity, then you can have. Like some of my friends think if you have protein powder, you're going to become slim. No, it doesn't work.
And you put on muscle as well.
Exactly. Which women cannot put muscle. We don't have those hormones to put on muscle. Because when I was taking class, a lot of girls, when I took a lot of weight training, no, I don't want to do weight training because I'll put on muscle. But it's just a myth. I mean, women cannot put on muscle. Anyways, so protein is good. I have been taking whey protein. I always had this myth. But how that we're not supposed to take protein. But how much chicken can you have, dog? How much chicken? Like they say a woman needs 36 grams of protein every day. And I think with the chicken breast, how many grams do you get? get the required sufficient of protein every day.
Correct.
So even
you have your dals, you have your egg, you have all of these things.
Yet
so
you don't get your sufficient protein.
Once you're working out, you don't require. I mean, your body requirement is not met.
Yes.
Okay. So that is the reason where you add on supplements to your protein powder.
Okay. So a lot of protein that includes chicken breast, eggs, protein powder.
Yes.
And what about vegetarians? What can they have for protein to
lots
compensate?
Lots of dals, soya, all these things. Paneer, of course, curd. All these things, are very rich in protein. So that's their, what they can have.
Other than that, what else to? What kind of food to take? Other than that. Okay, so we have to have food with lots of antioxidants. Okay. Because there's oxidative stress which is happening in the body. Okay, so lots of vitamin C, vitamin E, foods rich in all these things. Okay, so that is something which is important. The probiotics.
Probiotics is another thing which is important.
Curd.
So curd. Yes, that's what we're talking about. So curd is very important. So the gut health is very important for us right now because more than 80% of your immune cells are created in the gut. Okay, so the gut health is something which you have to really concentrate on and not tax yourself with junk food or the fast foods and things like that. So post COVID, people are in isolation and all that for 14 days. They've eaten hospital food and everything. They come back and they're like, "Doc, can I have one pizza today, please?" Okay, so I'm like, "No, you can't." Because this is important.
Yeah.
It's not only the COVID phase which you're taking out, tackling. You're supposed to be taking care of yourself even after that. Okay, so you don't fall into the post-COVID syndrome, right? So that's something which is very important.
So you have to take care of yourself the rest of your life.
Definitely.
Rest of your life.
A little more conscious efforts to be made, at least 2 to 4 weeks after post-COVID.
So this is like a total lifestyle change. See, they say.
So sorry to cut you, but then exercise is very important.
Yes.
Okay, exercise releases.
I've been screaming my lungs out the day I started my YouTube channel or on my Instagram or on Facebook. How important exercise is.
Yes. So exercise is very important where endorphins are released. Okay. So endorphins are natural painkillers. Okay. And they also are, they remove the free radicals and the oxidative stress is taken care of. Okay. But then you're not going to jump back to your earlier routine. Then you can't start from where you stopped earlier. Okay. You can't go to a gym and start deadlifts and things like that.
No, I have been hearing a lot of people working out in the gym and just passing out. A lot of heart attacks has happened.
Yes, that's
during this last 2 years.
That's all the inflammation and oxidative stress which is happening.
So is this all related to COVID?
Yes, undoubtedly. So that is why we are talking about aftercare. Aftercare of COVID.
So post COVID, they go and work out in the gym, and
Yes. So you have to be really careful. Yeah, you have to start slow. Start under pressure. Like how you were as a beginner.
What about me, doctor?
No, no, you're good the way you are.
Okay.
So
sometimes when I'm spinning, the workout gets really intense, and then I suddenly remember, what if I get a heart attack?
No, it's
then
not
slow down.
Not at all. Okay.
Hypothetically, I was just imagining, so many people we have lost.
With the kind of exercise regime which you're through, I don't think that's that's going to happen to you at all.
It's very sad that a lot of friends also have lost some of the celebrity friends in Chennai or in Bangalore.
Correct.
Doing workout. One of my doctor friend, he's a dermatologist, Dr. 𝒟𝑒𝓕, I don't know, he's also a skin doctor.
Oh yes.
So he was he's a good friend of mine, such a healthy doctor. He told his family, I'm going for a walk, and he got a massive attack. I don't know, it could be COVID related, somewhere there is, interrelated, I don't know. May his soul rest in peace. So, a lot of care has to be taken. I keep telling my students, my friends and my family how important exercise. So they all think this lady has nothing to do. Either she's working out, sleeping, cooking, again work up. It's such a routine, and I scream my lungs out how important exercise is to, in one's life. How you somehow at some time in this 24 hours. Now I have friends who says I'm very busy. I'm very busy. I don't buy that. I don't buy that at all. Anil Ambani used to wake up at 3:30 in the morning, run, and then go to work.
Correct.
So somehow fit in that 45 minutes to 20 minutes at least into your daily routine.
They're so busy, then they'll rest when on the hospital beds. You can't really help it.
Exactly. So
you can only warn them.
People used to make fun of me. This lady is all the time talking and only talking about exercise, and then the whole God couldn't take this lifestyle, that sedentary lifestyle, what people were doing. Sometimes waking up late, eating out, partying, social. Oh, that is fine. Even I do that. You do that. Everybody does. But everything has to be to a limit.
Correct.
We should know our responsibilities. Now, how many of us used to come home and, wash our fingers every day?
Exactly.
Including me, I never used to do that.
Really? Oh.
Yeah, I do it once in a while, but honestly, like when I'm really tired, when I come home late, we have forgotten. We have forgotten, like 90% of the population, unless you have an OCD problem, always cleaning your hands or, now once I go out, I have to completely have shower, clean, gargle, all kinds of things. So God is, maybe if you see it in a positive way, we all have changed our lifestyle. Everything to a, to a limit. Bringing in workouts together. And now see all this food habits. See, now we are literally, it's like God has put a gun into our forehead and said, you have to do this, darling, otherwise you're not going to survive. Especially this 2 years pandemic, the fittest survived. The fittest survived.
Again, the uncertainty which is like, giving people the fright.
Yeah, the fright. Yeah, otherwise we wouldn't.
And that is where you see the shift happening, Yes. So that's a good thing.
Yeah, it's actually, that's what I said. See the positive side.
Was this required for the change to happen?
Definitely not. It's a very sad thing.
We should have thought about it.
If you see the positive side, as I said, I hope and pray this is the last pandemic the whole my generation, my future generation sees. I don't think we can afford to go through this mentally. And during this, a lot of people post-COVID also are mentally very disturbed. Again, exercise. If you ask me exercise, what would you suggest other than exercise?
Exercise, then I would say you start off with something like meditation. Breathing exercises. Okay, very important. Now, the stress is so much. Stress is from the workload which they are facing. The work environment is changed. The family environment is changed. The family dynamics have changed. You have children over there. You have to see it.
And the worst part, children are at home the last 2 years. What happens to mothers like me?
Exactly.
24/7 you have to take care of them. At least we had this, luxury from 8 to 3. Kids are not at home, husbands are not at home. I used to have the house for myself, leave the dog inside and happily sleep, work out and sleep. But then again, that's a stress.
That's a stress.
Stressful thing.
That's adding on. There's a financial burden. We don't know what's going to happen. We don't know what is happening tomorrow.
Yeah.
We have to, take care of our family.
A lot of people have lost their jobs. On top of that, stress. No money, sitting at home, stress.
So first of all, and of course the COVID situation.
Yes.
Okay. You're even scared.
And all the physical changes.
You're scared of stress. Because you're stressed out because of COVID as well. Okay. You're scared. You might.
That fear.
The fear. Of course, the fear is like rampant in so many people. So what you need to do, you need to sit down, calm yourself down, and you need to start meditating. Okay, that is where you start becoming mentally strong.
How do you have this confidence? Because I cannot meditate. I have this problem. You ask me to exercise, dance, or whatever, but I have a problem meditating. They say the mind is like a monkey. I have like a million negative thoughts coming. So how do you concentrate and meditate? Give us some tips on that.
See, concentrating and meditating. If you don't want to close your eyes and meditate, you can even open your eye. Okay, put a candle in front of you and just keep looking at it.
Okay.
Just try to just try to feel the peace around it. Okay. In a calm place, without people, around you, without, children cackling behind you, or, the cooker blowing its whistles around you, okay, without all these tensions. So that's why, that's why they say you have to start earlier. Okay, early morning at, 4 or 5 in the morning, there's no one's there to disturb you, and you start doing this, okay? So you start doing
like the candle,
yes, just keeping the candle, okay? If you're, a little in a better position, then you close your eyes, you chant, start chanting whatever prayer, okay? Whichever religion you belong to, whatever prayer, just keep remembering God. Thank Him for the day which is
gratitude.
Yes, that's
I had told in one of my videos, we are so blessed to be sitting, talking to each other. We are alive today. And not complain of the things that we don't have. Being alive today is the biggest blessing. They say you can buy a luxurious bed. Money can buy a luxurious bed, but money cannot buy sleep. Money can buy an expensive house, but it cannot buy a peaceful home, stable home. So we all thought money can buy everything, including me. But then this pandemic again has taught us money cannot buy, because the richest of riches have died. Because lack of health. It all boils down to health. How important health is. So we are the richest because we have health. That's why I keep telling my viewers, please exercise, bring that routine, workout routine to your day-to-day life. Anyway,
so what people actually say is when you evaluate, or evaluate your human body, the body adds up to around 300 crores. Okay. Wow. And so that is the wealth you already have, which you are not really, which you take for granted. Okay, which you don't really care for. you're still looking at something else, another lakh somewhere, another 2 lakhs somewhere, you know.
Oh, I don't have a house,
exactly, I don't have this, you know.
I don't have a dress.
But you already have so much which you're not really appreciating.
That's what gratitude, practice gratitude.
So,
my husband always says, the first thing when I always say, I want a better house, I want a better car, I keep asking, he says, you know what, don't underestimate what you have become to be.
Correct.
Okay, the first thing you wake up, always practice gratitude. Thank you. You are so good, you always tell me, you're so good looking. Thank God, God has made you, given you such good looks.
Right.
No, it's genes and it's my hard work. Okay, fair enough, it may be.
Yeah.
But it is also a form of, God's gift. It's a blessing.
Right.
Beautiful 2 children,
right.
Beautiful family.
Lovely.
So, if I'm sitting in my wake up, I can brush my teeth and get ready and go and work out. It's a huge blessing.
Correct.
There are so many people in the hospital. Once I had gone, my friend was suffering from cancer. It completely changed my life. So I had gone to visit her in the one of her chemo sessions. I had this self-realization when I walked into that cancer hospital. Very small children were suffering of cancer. They shaved their head, they put their bandana, and then, I was sitting there for an hour, and then I came home and I had tears in my eyes. I said, why am I complaining of life? God has given me everything. Beyond this, if I complain, I am the most greedy woman in this world. Self-real, and I am not ashamed to accept it. I am not a perfect woman. Nobody is perfect. We all learn through our mistakes. We all learn through. We become so wise after we've done a mistake. So
there's a need and there's a greed.
Exactly.
Okay, need is having
there's
a plate
fine line between need and greed.
Exactly. Having a plate of food, 3 times a day is a need.
Yeah.
Okay, greed is, having a 5-star meal, 3 times a day.
You can buy a luxurious meal in a 5-star hotel, but you cannot buy good health.
Correct. Lovely. Yes, lovely. Yeah.
So, doctor, thank you so much. And anyways, so thank you for all the post-COVID care, food, come right from food. And a lot of people suffer from hair fall also.
Oh yes,
any suggestions
that's
on
a
that?
very common thing we're coming across right now.
Yeah, not only COVID, other reasons also. Men suffer because I have a lot of clients who come and ask me, what do you do for hair, what kind of food to take, any multivitamins to take.
Right.
Do you have any suggestions?
Yes, of course. So basically, talking about COVID, what happens is, when you're going through the process of COVID, the body channelizes its energies into taking care of the larger organs. Okay, so all the nutrients are diverted to such organs, and hair is given a second priority, right? So the hair follicles are devoid of their nutrients, right? So out of our entire
Can you
scalp.
explain this in a simpler English, because these are all medical terms. So how does this hair growth? How does it affect?
So basically,
simpler English.
hair on your scalp, 85% of the hair is in the growing phase.
Okay,
at any given point of time.
Okay.
10% is in the resting phase.
Okay.
5% is in the shedding phase.
Okay, got
so
it.
that is how the normal equation is. Okay. But here what happens, because the nutrients to the hair is taken off. Okay. Lots of hair, around 30 to 50% of it is pushed into that resting phase. Okay. After which, if your body is already well nourished and everything, it will come back. It will grow back. Okay. It will come back to the growth phase again.
But if they don't, lifestyle.
With the lifestyle. Okay. But then if it's not, then it will go into shedding phase. Okay. That is where you start seeing lots of shedding of the hair which is happening. Okay. So that's called 𝒕𝒨. So then it doesn't start immediately after COVID. Okay. It's not only COVID. Any kind of viral fevers, anything which are going through. Any stressful event, any stress
smoking
to the body.
Is, I think.
Oh, smoking is another deal. We'll come back to smoking.
Yes.
Okay, so what?
I want to come back to smoking and alcohol.
Okay. Yes.
Alcohol.
Okay. So what happens is, that's what is happening, and so the hair fall is seen after around 3 months. Because 3 months it's in the resting phase, then it starts shedding. So that is when you start seeing the hair fall.
So it's all lifestyle really.
Yes, it may be there for 3 to 4 months. Correct. So if you supplement yourself well, then it grows back again. If you don't, then you need some other, therapies, PRP, and some procedures to be done.
And any multivitamins to take?
Multivitamins, yes, definitely you have to take. All these micronutrients, zinc, iron, all these things are immune boosters. Okay. So you'll have to take a lot of these supplements. Okay.
Along with your nutrition.
Along with the nutrients. Along with the normal nutrition. Okay. You have to take some supplements of all these. Okay, and vitamin C, of course. Okay. Now vitamin C again is a superfood. Okay. So superfoods are foods which you take in small quantity, but you get magnificent, results.
Moringa leaves.
Moringa
leaves is a huge form of vitamin C.
Okay, so amla every day. All these things you start incorporating in your diet. Okay, you're already taken care of. Okay, so that is something which you have to do. Okay,
so men or women, generally men lose a lot of hair.
Men lose lots of hair.
Now even women lose a lot of hair.
Yeah. Okay, so men is because of the DHT, the testosterone, so it's called androgenic alopecia, AGA. Okay, androgenic alopecia.
What are the bad habits that causes hair fall?
Yeah, that's a
2 or 3 bad habits. Because I need to tell my viewers, because if I tell, they don't understand. If I tell my friends, they don't understand. So if it's coming from the doctor's horse's mouth, so it it registers.
Yes.
Smoking
Definitely,
is one.
yes.
It causes hair fall.
Causes
Brings
hair fall.
your immune system down. It's all interrelated.
It's all interrelated. And again, smoking and alcohol immediately after COVID, no. Okay? Because again, when you're smoking, there's inflammation which sets in. Your lungs are already inflamed. You're just recovering. You're adding fuel to the fire there. Okay? So you're not going to be smoking. That is for sure. Okay? I would say at least for 8 weeks. That's 2 months. Okay? After that, depending on how you are, it's better if you've anyway taken a break, you might as well cut it off.
Might as well give it up.
Okay, so that is one.
Okay.
Now alcohol, again we spoke about gut bacteria, right? So when you consume alcohol, what happens is the good bacteria is destroyed.
Okay.
So the bad bacteria grows.
Sorry to cut you short again. So I have some doctor friends, I don't want to take their names. So they're saying, what, we won't get COVID because we drink alcohol. So what logic is that? They say, what is hand sanitizer? It's got alcohol content, right?
Yes.
It's got, so we use hand sanitizer. So this is like you're having alcohol. You're sanitizing your throat.
Yeah.
I don't understand the logic. This was quoted by a doctor friend.
Okay.
Doctor friend. Some cock and bull story. I'm sorry, but then I didn't buy it. But this is the kind of mindset people have outside. I mean, if you have alcohol, you're not going to get COVID. You're not going
indirectly it depresses your immunity. Okay, your immunity is already low. You already had COVID. Okay, now you're depressing even further, and you're not, helping yourself to recover. Okay, so again,
anything in a moderate level is okay.
Yes, but then not immediately. Okay, like again, my patients again they call immediately after COVID, and they'll be like, the doctor is so long since I've had alcohol. Can I have 1 beer, doctor? So there I put my foot down and say no. Okay, you're not supposed to be doing it. It's your take at the end of it.
Yeah.
Okay, it's your call, but I would say no. Okay, you have to wait for at least a fixed amount of time, and after that, probably if you're completely doing well and everything, then you can probably have a beer or 2, but then not, what you want to do right away. You come out of the hospital and first thing you want to go and hit the bar. No, not happening.
Okay. And one more very important question. So we've all had vaccinated. We have had. I've had Covishield. So I have friends. I do get a lot of clients come and ask me. So I've just had my Covishield first dose. Post Covishield, how long? Within how many days can I drink? Second dose. After how many days can I drink? Is it okay before the vaccination can I drink? Everybody's question revolves around alcohol.
Right.
So, okay, just to answer that, is it safe to take alcohol post your vaccination?
See, the ICMR guidelines say, initially they said, no alcohol for the next 10 days. I mean, 10 days post
and pre.
Post vaccination.
Okay.
But then later there were papers published because it was people could not come to a common consensus. Okay, they could not say if it is actually affecting it or not affecting it because studies, obviously, like I said, it's a new virus. We don't know how the studies are. We don't know how the vaccines are working. Okay, so we couldn't come to a common consensus. But then I think because our vaccines are not rampantly available. Okay, we need to treasure it. Okay, when we're getting a vaccine, we need to treasure it. So if even there's a 1% chance that the vaccine could go bad after consuming alcohol after the vaccination, why would you want to take the chance?
Exactly.
Okay,
but
so
they know how people are. No, they cannot control. When it comes to alcohol, people cannot control.
It's your conscience. I mean, so
it's all in the mind.
It's all in the mind. So a healthy, like I said, even earlier, a strong mind is, gives you a healthy body. Okay, so you have to be really strong in it.
So there are some cases who have had a severe heart attack post the vaccination. Any say on that?
See, there were lots of things.
Exactly,
which again were blamed on vaccines. Okay, probably anyway was going to have a heart attack. Okay, which he had. Okay, and coincidentally, it happened around the time when he took the vaccine. So it's not really good to blame it and say that is bad. Let's not take the vaccine. Vaccines are good.
I've had both my vaccinations.
Exactly. So,
absolutely fine.
Yeah, 30% of whole of India is vaccinated with double dose.
Lovely.
Okay, so that's one.
So which vaccine do you suggest? I've had Covishield because it's accepted in Europe. So I travel a lot. So Covishield has accepted in Europe.
Yeah.
So other than that, now they have this Russian vaccine, Sputnik.
Everything is, almost the same.
Almost.
Okay. So it's not like one is better than the other. Okay. Whatever, even the Indian made ones are equally good.
Okay.
Okay. UK is actually, even quite surprised that India has, such developments. Because they have colonized us and they are, still in a era where, they are not, as forward as us. So, we are doing really good as, yeah. And almost I think 60% has taken the first shot.
Okay.
There's still, a little bit more.
I've taken both my shots. Anyways, doctor, thank you so much for the post-COVID care and telling our viewers about skincare. Give us a small summary about skincare. You have been my doctor. I've been coming to you from the last 5 years, and I'm
so probably you should do it now.
I keep telling my subscribers, I keep giving them skin tips and all. But then if you are going to be telling them, it will be more. It will register further. So basic skin tips for women. See, I know it's all related to exercise. First thing is exercise.
Correct.
Exercise. Other than that, what skin tips would you give for a glowing, radiant skin like yours?
One thing which we have to re-emphasize and always keep emphasizing on is using a sunscreen. Okay, so that is one thing which we have to
Even if you are at home, you have to use.
Even if you are at home, you have to use sunscreens because it's even the radiation, the lights like what
shooting lights.
Exactly. Okay, the lights like this, from the windows. From the doors.
Sunlight.
It's not the sunlight, it's the radiation you're talking about. Okay, it's not the direct sunlight, but the radiation you're talking about. So you need to protect your skin from all these things. Okay, so using a sunscreen
is a must.
And using a sunscreen multiple times in a day. So at least
how often do you use it?
Once in 4 hours is what prescribed. Okay.
Even if you're sleeping.
Even if you're in a closed room without any kind of.
I use it once in the morning, once in the evening. That's it.
Once in the morning, once in the afternoon is better. Okay, if you're going directly into the sunlight, then once in 3 hours you're supposed to be doing it. Okay, and so that is one thing which you'll have to start off with.
Sunscreen
is a must. Okay, depending on how your skin is. If it's oily skin, then you use a gel base. If it's
so what
skin.
advice would you give women 40 plus for good skin and good hair?
Correct. So that's too much, huh?
Because that's what they're going to ask me.
Yes, of course. So
youngsters can have good skin. It's natural. I mean, they are young. Everybody can have a good skin at that age. But then post 40, how do you maintain?
So one is sunscreen. Okay. Then the second thing is using a good night cream. Okay. So night cream should have retinol. Okay, which is a collagen inducer. Okay. So as you age, what happens? The collagen in the skin starts getting reducing. Okay. So you are trying to boost the collagen in your skin. Okay. So you have a youthful skin. The fine lines, wrinkles are taken care of and all that. So you have to have a retinol based cream. You could add on hyaluronic acid or a vitamin C again. Okay. So that
vitamin C cream you're talking about?
Cream, serum. Okay. Depending on your skin.
But if you're having a lot of vitamin C food, isn't that enough?
Is also good. But then
along with
we're talking about topical applications as well. Okay. So even the sun damage, does not happen as much when you're using vitamin C. Because once the sun rays fall on the vitamin C, the vitamin C disintegrates. Okay, but the skin is still left good underneath. Okay, so that's something which you'll have to start with.
And hair care.
Hair care, now there's again a myth that hair should not be washed on a regular basis. Okay, people say
I wash it twice a week.
Twice, alternate days is good.
I sweat a lot.
When you sweat a lot, washing it off is much is better. Is a good thing to do. And using a very mild cleanser, not strong shampoos,
sulfate-free
shampoo, paraben-free shampoos. Okay, all these things are something which are very mild.
Along with that is your food habits, especially hair is food habits.
Food habits. Now, hair can also be related to hair fall. Could be, there could be 100 of things which are happening inside the body. Okay, it could be vitamin deficiency, iron deficiency, iron deficiency, your thyroid, your hormone imbalance. All these things are adding on, and the side effect of that is a hair fall. Okay, people blame the water or some pollution or a helmet or something like that. Okay, but it's not that. There's something which is happening inside your body which is triggering your hair fall. Okay,
so better you go for a medical checkup.
So you have to
sort out what is happening inside and
see what exactly is going on. Address the root cause so that you can just take.
So you know what, the viewers can contact Aneesh for any kind of hair and skin problems. Okay, so of late, everywhere I see they're talking about this glutathione injections. Can you give me a brief about what these
glutathione we just mentioned earlier.
Yeah, we mentioned earlier, and I even asked you earlier in one of my visits.
So glutathione basically is a cleanser. It removes the it removes the free radicals from our body.
Okay, so you have to give it in your It's like
they
an
can
IV.
take it, yeah, it's like an IV. Okay, that is the test taken.
IV,
okay. Oral tablets are also available, but the efficacy is not great because they go through the stomach and it's getting disintegrated with the gastric juices and everything. IV is much better. And what they were initially taking it for was a cleanser for the body. All these gymmers and bodybuilders, they're taking it as a cleanser for the liver. Okay, and they noticed that as they noticed people who were taking that started becoming lighter on the skin. The glow started increasing. Okay, then they were wondering why, and then that is what it's used for now.
Okay. Skin lightening.
Skin lightening. It's being.
What are the other benefits along with that?
Your general, general health is improving. But only thing is
how often do you take it? How often should we take it?
Depends on if you've taken it earlier or not. So initially, if you're starting off, then you take it once in a week.
So you have that option in your clinic?
Yes.
Okay.
Nice. So once a week, you take it for around 6 to 8 weeks.
Is it a very expensive procedure?
Not very expensive.
Not very.
Yeah.
If it's affordable, why not?
Yes, of course.
And okay, so generally, these celebrities, movie stars, why even women post 40 and all. So what is your say on fillers and Botox and all? Is it absolutely necessary?
Fillers and Botox,
will it make me look very pretty if I have to get it done?
Oh, of course, it will enhance.
Okay.
You're already pretty, it will make you look more prettier. Okay. I don't know if that's even possible with you. So post 40, what basically starts happening is the fat pads, which we have, when we are youthful, it's nice and firm there, okay? So as you start aging, the fat pads start drooping because of gravity, because the loss of support, like I said, collagen is reduced in your skin, elastic tissue is reduced in your skin, so you start drooping. Okay.
Face starts drooping.
Yes. Okay. And because of which you start getting all these nasal smile lines and sunken eyes and all of those things. So that is where your fillers help. Okay. So we are putting in a filler.
So what are the side effects of fillers?
There's absolutely no side effect in filler as long as it's done in a good hand. There's no problem at all.
And is it a painful procedure?
Absolutely not.
And what is the difference between a Botox and a filler?
See, Botox is something which is going to relax your muscle. Okay. So it's basically dealing with your wrinkles. The dynamic lines, they become static lines at one point of time. Okay. So because the muscle is moving under your skin, the skin is thrown into those folds. Okay. And eventually what happens, because of the continuous movement, the skin lines start developing and they don't go even when you're not making the expression. Right? So that is where your Botox comes into play, where you're relaxing the muscle, so the skin above that is relaxed.
Okay.
So your pros.
So no side effects for that also.
No, absolutely.
So is that also a very reasonable procedure?
It's not very expensive, and I would suggest that people start with their anti-aging processes a little earlier, because the requirement for anti-aging later on.
We all have this block, right, in our heads, especially women. Like it's not safe. It looks very plastic. And
not at all. It can be done in a way.
Yeah, it all depends on your doctor.
Yes, it all depends on how you want to look. The doctor will tailor-make it for you or custom-make it for you.
But our Indian culture is we still have a block.
Right.
Abroad it is like everybody does it, everybody does it, every second person does it. But still we are still slowly learning all the skin techniques.
Correct.
Anyways, so you've given us a brief about skin care, hair care. Thank you so much, doctor. Thank you so much for this wonderful interaction. Thank you so much, because it was a very, very important topic and I wanted to bring in an expert only. And thanks for being such a beautiful friend and a good doctor to me from the last 5 to 6 years. He's been my skin doctor from the last, so thanks for taking all my crankiness and every little thing I come, doctor, my hair is falling, my skin is, I have a pimple mark, and everything you treat with so much of patience and
but it's really great to even have you over. You're so chirpy and bubbly that the whole day's stress is just gone. I love spending time with you when you're in the
Thank you, doctor. I'll take that as a compliment. And so you opened your new clinic, right, in Indranagar. So how old is it now?
I just started,
a
few months old.
So all my viewers, any skin related or hair related, I will put his address, your clinic address in the description, and I will tag him on Instagram. Any queries you can contact him.
Thank
He's
you so
much.
He's
a very never doctor, and more than that, you never have that. I never had the doctor feeling with you. Whenever I come there, it's like I'm going for a for a party or something like that. So, anyways, I hope you all had a nice. You got a lot of information, post-COVID care, skin care and all. And doctor, thank you again for coming.
Thank you,
thank you so much again. Thank you so much, doctor. God bless you.
Thank you.